Are we ready to have a serious national discussion about mental health? With the U.S. death toll from COVID-19 surpassing 1 million this May, it seems wrong to speak of there being a silver lining to the pandemic. But crisis does create opportunity, and one such opportunity may be having more frank and open discussions about mental health and mental illness. For years, one of the things that have held back progress on mental health has been the stigma and shame surrounding mental illness. That stigma appears to be waning, at least for now. A lot of people struggled with their mental health during the pandemic, and for good reason. The news was full of disease and death, and an overwhelmed healthcare system. Lockdowns deprived us of social contact and disrupted our normal routines. People were stressed and stressed out, and perhaps more so than usual. A survey in 2021 by the National Alliance on Mental Health and Mental Illness found that 52% have been more open about mental health since the pandemic began. And this year, the Journal of the American Medical Association found evidence of the first significant decrease in public stigma in the U.S. around depression. There are also some hopeful signs in the workplace. Many depend on the coverage provided by their employer for necessary treatment. And if mental health issues are stigmatized at work, with people afraid to seek help or ask for mental health days for fear of being seen as weak, mental illness will remain in the shadows. According to one survey, 23% of workers say their employer introduced new mental health benefits during the pandemic, and growing numbers of business leaders are stepping up and saying it's okay to talk about mental health at work. Yet, we still have a long way to go. Only 32% of employers offer mental health days. 41% of employers are not covered by therapy or counseling. But the biggest problem is the gap between the coverage you may think you have and the coverage you find out you actually have once you decide you need help. Nowhere in the healthcare system is there a gap larger than the area in mental health, due largely to low reimbursement rates. Only 56% of psychiatrists who treat mental health illnesses accept commercial insurance, compared to 90% of physicians. As a result of finding a mental health provider in your network who accepts your insurance and is taking new patients can be next to impossible. So it's not surprising that those who seek mental health services are 5 times more likely to get care from an out-of-network provider than those seeking medical help. That means you're paying out of pocket, which means many cannot afford to do so. On top of these coverage issues, the network of mental health service providers is woefully underfunded and underdeveloped. The Kaiser Family Foundation finds that 120 million Americans, nearly 40% of the population, live in underserved areas. And on top of this question of access are the racial and ethnic inequalities we have seen exposed through the healthcare system. The area of mental health is no different. The Brookings Foundation reports that, on average, only 45% of Americans with serious mental illnesses get the mental health services that they need. That's low enough, but those numbers are 55% for African Americans and 56% for Hispanics. Making matters worse, the stigma around mental health issues tend to be higher in minority communities. In his State of the Union address, President Biden put forth an ambitious plan to renew our nation's mental health system. He suggested a focus on the needs of youth and children whose mental health has suffered greatly during the pandemic. He proposed building up the mental health workforce and creating permanent funding for community behavioral health centers. But Biden earlier offered a similar ambitious package around care infrastructure to address our child care crisis and other related issues. And his proposal went nowhere. So the question remains, when will we as a nation finally be ready to seriously address mental health? If not now, after all we've seen and have been through during the pandemic, when?